Since completing the Masters, my professional practice has changed unrecognisably. I qualified as a clinical physiologist in 2009, and then I was doing different cardiac testing. So I was reporting on those different tests and then passing that information on to a cardiologist. Now I'm undertaking my own clinics. I do history taking, examination, and I give the patient all the information, and I can provide a management plan which is looked at by a prescriber, because unfortunately as a physiologist I'm not able to prescribe. I'm hoping that's something that will come in the future. I've been able to develop new services alongside the team that I work with. We've developed valve surveillance clinics, and that's transformed the service as well, because we've been able to take patients who are currently on a long waiting list from secondary care that have got known valve disease, and now we see them in a one-stop clinic, which saves these patients multiple appointments in secondary care. And we can then make sure these patients are seen in a timely manner, following safety standards and the scanning standards as well. We're also seeing new patients with murmurs are identified by GPs as well. And again, this is all taking pressure off secondary care and ensuring patients are being seen nearer their homes. We've also set up an assessment of cardiac device information, and this is all through my dissertation. So I did this as my dissertation project and implemented it into my work. But what we do is we take information from implanted cardiac devices and we look at any signs of decompensating heart failure. And now it just means that we can see patients are flagging up as early risk of decompensating heart failure, and we're able to manage that risk early before they need to go into secondary care for treatment. And we can do that in a lot of cases without any face-to-face contact. So for me, it has just changed my direction of my work completely. And I'm very grateful to be able to have developed and be doing so much more than I ever expected to do.
My practice is just completely different pre and post Masters. And it would be really difficult to imagine going back and practicing at a level as if I didn't have the Masters, because every day I see it making an impact and making a difference to my patients, and the satisfaction that I get because of that. So for example, I work with heart failure patients, and I'm able to diagnose heart failure. I'm able to give that diagnosis, set up a management plan, implement that management plan, and I prescribe medications there and then on the day, monitor the effects of that, so renal function, alter accordingly to any physiological effect it might have on the patient. If a patient comes into clinic and they're full of fluid, I can adjust their medications, introduce new medications, stop-start medications, depending on what I feel is the cause of that decompensation, to avoid hospital admissions. And it sounds a bit dramatic, but it can save lives. And certainly, I cover quite a rural area down in South Meirionydd, so it's a long way. There's a lot of travel burden for patients going up to their main district general hospitals, and often their loved ones who may not have spent a night apart might spend weeks apart from each other if that loved one is admitted. So for me, it gives a lot of job satisfaction to be able to make those changes there and then to the patients. I felt when I was doing the Masters, although it was hard work, sometimes my brain felt like a sponge that was completely saturated, and in order to get any more new information in, something was going to have to leak out. But it has changed the way that I process things. And I remember saying, sort of not long after I'd finished the Masters, dots have been joined up. So there were things that I didn't quite understand, or maybe I didn't even know that those dots needed to be joined up in my nursing practice. And those things make sense to me and really give me a fuller, richer picture. And being able to prescribe and making that change there and then, I just can't emphasize enough what a difference it makes, what an impact it has on job satisfaction, but on my patients and their outcomes as well.